right, welcome to Health Check on VOP TV. Good afternoon. I'm every person watching me live on VOP TV this afternoon. I am Fina Okechukwu. And on Health Check, we discuss different health issues and possibly profess solutions with the help of experts in the medical field. Yes, that's what we do. And talking about profiling solutions and, everything that we as rest of the people, we also have more than a voice now. What we look at. Now, I need a drum roll for this, for me to tell you what just happened. This is the breaking news. We heard that the members of the House of Senate will also sit today. CBN will sit today to look at the MPC. Today they have their meeting to talk about the monetary policy rate. Yes. And now we have another increase on that. It is at 26.25%. This is just what is coming up from the MPC meeting that they just concluded today. And here is where Nigerians are talking about the inflation. Food inflation is at 40.2%. And we have headline inflation to be at 33.69%. And also, we have the cost of drugs skyrocketing. For example, getting an analgesic now for those who are going in for surgery, it is very, very expensive now. Are we going to look at those who are down with asthma and all that, sickness or diseases that is related to one that need to use inhaler and all that? We have some other foreign medical companies checking out of Nigeria. Yes, we do. And there's so many other things happening in the country. I just wanted to break down this for you to know that now we have a monetary policy rate to be on 26.25% after the MPC meeting. All right, back to what we have to talk about today on Health Check. I told us before now that we have a medical practitioner in the house who will help us look into the topic of the day. We have Dr. Rebecca Olofin-Mokili. She don't want me to put that one, but I love putting it. Yes. She don't want me to put it Olofin. She want me to just say, my name is Dr. Rebecca Mokili. She's a medical doctor for over 14 years experience in health and wellness, a professional for over 7 years. And as the case may be, she is currently writing a weekly online column to over 7,000 lawyers. And she also wants to help professionals give their optimum daily without mortgaging their health for their career goals. She's currently studying integrative medicine at the Quantum University in Hawaii. Yes, and it's her vision. I love her because she has this vision that by 2025, at least 10,000 professionals will be able to give their best in the various fields of endeavor and still remain optimum healthy. Okay, so if I were you, I'll just get my seat, sit down, buckle up, and enjoy the show as the ride begins. But before we move into the topic of the day, I will encourage you to click on the button, on like button on social media platforms, like the Facebook, just like our Facebook page. We are Voice of the, we are VOP TV Live on Facebook, on Instagram, on X, on TikTok. And on YouTube, we are Voice of the People TV. Just get there, subscribe, click on the bell button to be part of every show we do on Voice of the People. And then there's a number also on your screen where you can call us on WhatsApp or send us a WhatsApp message on the particular number if you have any question or any comments you want to drop as regards the show as it unfolds. On the show today, we'll be looking at obstetric fistula. Yes, and that is the reason we have two women talking about something that actually concerns us. Yes, although fistula concerns a lot of people, but when it gets to this one, it actually affects us, or it concerns us. Yes, because every year, over 50,000 to 100,000 women worldwide are affected by obstetric fistula. And this is an abnormal opening between a woman's genital tract and her urinary tract or rectum. And in Nigeria, let's bring it down to us now in Nigeria. They say that 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. But here in Nigeria, we have it to be over 40%. We Nigerians are contributing over 40% of the total number of women who are down with this particular health challenge. Okay, and now you know. And like I told us, it's just an abnormal opening between a woman's genital tract and her urinary tract. But I have a doctor here with me who will tell us what this Obstetric fistula is all about. What is fistula? Let's start with. You know, the don't be like say it's too big. Not for break, I'm small. Make people understand.
So hello once again, everyone. And a fistula basically means an opening, an abnormal opening. It's not a natural opening. It doesn't normally occur there. For example, normally everybody has an opening at their mouth area.
Yeah.
Everybody has an opening at their anal area. Okay. But in this one, it's an abnormal opening. So something happened that created this opening. And obstetric fistula, which is the topic we want to talk about today. Obstetric, from the name, you know, it's talking about pregnancy, pregnant women. So it's an abnormal opening between a woman's genital tract and either her urinary tract, anywhere along the urinary tract, and the rectum. And it is usually caused by anything that has to do with obstetrics, and the most common thing that has to do with obstetrics is giving birth, pregnancy. So that is what causes, and that is what an obstetric fistula is. Of course, there are other causes. If there's cancer, if there's irritable bowel syndrome, if the person is overly exposed to radiation, all those things could cause a fistula. But when you hear obstetric fistula, it's usually caused as a result of pregnancy.
Okay,
yeah.
Pregnancy. Now, you know, you made mention of this, and that's how to take us to, you know, I stay in the north. A lot of people know I do that. And, you know, when you get to the northern part of the country, you have the issue of young girls, you know, being married off. Even in Niger State now, there's this back and forth about why 100 females should not get married, orphan girls should not be married off and all that. But it happens. There was a time, one time, senator got married to a 14-year-old girl in Nigeria. And that brings me back to this question I want to ask you now. At what age does this obstetric fistula occur?
Okay, it can occur at any age.
All right. It
can occur at any age. I will explain some of the things that predispose one to obstetric fistula. So it can occur at any age. But, of course, a girl that is not fully developed and is exposed to sexual intercourse frequently is more likely to have obstetric fistula than a woman that is of age. She's 18, she's fully formed, she knows what she's getting into. So a young girl is more likely to have this. And that reason why many times it occurs, especially in areas that there's a lack of adequate medical care, there's a lot of poverty, okay, and the women are underskilled. Okay, areas like that, the women are more likely to get obstetric fistula. And I will explain. Because the woman may be of age, but she may not realize that she's having too many children, 1. 2, she may be of age, but she may not have access to quality, not even quality, basic antenatal care. So it's never picked up that maybe her baby is big or anything, okay? Or it's never even picked up that there is something wrong with her baby, because I'm sure you know that many times, many of these women that end up with obstetric fistula, they also usually have what we call IUFD, that's intrauterine fetal death. Their babies die inside their stomachs. That's actually part of what causes the fistula. I will explain more. So it's not, apart from the underdevelopment of the body, the fact that the person has, that's what's the word I'm missing out, prolonged labor for more than 24 hours, maybe 2, 3, 4 days. People think, she should be a strong woman, she should hold herself. Nothing like that. And as a result, she gets blood flow doesn't flow to some certain areas. She gets wounds in some certain areas. And once blood flow doesn't flow in a particular place, that place starts rotting, starts deadening, and forms a hole that leads to a fistula.
Oh, okay.
Yes.
Now, from all this, explanations you've given, you made mention of pregnancy.
Yes.
And now I want to ask you this: is it possible that a woman who has this fistula, can the woman be pregnant?
A woman that has fistula can be pregnant.
Okay. Okay.
But I mean, the only reason, let me say the only reason, let me paint the picture. So a woman that has fistula, these are the things she's dealing with. Depending on where in her body the fistula is. She's dealing with a lot of irritations inside. She's dealing with a lot of skin irritations because either urine or feces, some kind of fluid is leaking out. She's dealing with a lot of odors. So it's not likely that her husband will be meeting with her. But let's say they meet, she can attain pregnancy, but it will be very painful, and she's prone to a lot of infections because there's an opening in an abnormal place where it should normally not be. And once there's an opening, that means she's exposed to infections. There's poor blood supply. She's already, once the lady takes in, that pregnancy is one of the things that depresses immunity because of the hormones that are involved.
Yeah.
So the immunity is already depressed. Then there's an abnormal opening in the body where things like urine that contains bacteria, feces that contains bacteria is coming out, and then of course combined with the social and the emotional thing and the isolation and people feeling this one is smelling, this one is stinking, all those things, not knowing what she's going through and whoever put her in that state is allowing her to go through.
Now, when you're talking about this, you painted a picture of urine coming out and even a feces at some point. Now, can this fistula lead to miscarriage? Let's assume the woman now manages to get pregnant.
Of course, an infection can, yes.
Okay, it can lead to miscarriage.
It can lead to a miscarriage, but most likely someone that has a fistula, she may not even take it because she's not appealing.
Oh, she's not appealing.
She's having issues, you understand?
Yeah. But you made mention of, lack of exposure.
Yes.
And poverty also to be dry. And now looking at it that
way.
Of
course, a miscarriage can occur because she's not being properly taken care of. And many times, like I said before, fistulas don't only happen with first pregnancy. They happen with multiple pregnancies. Person over the different pregnancies, she's always exposed to prolonged labor. Before you know it, it's a muscle and there's poor blood supply there. After some time, it deadens, there's a hole formed, a fistula is formed.
Now I want to ask you also, what are the symptoms one needs to see? Or let's call it the worrying signs one needs to see for them to know you're having
a fistula.
A fistula.
Okay. Like I mentioned earlier, some of the symptoms are, the person will notice that there's irritation of the skin. They will notice foul odor. The most common one is leaking urine. Sometimes they will notice feces is coming out from somewhere that is not the normal place for it to come out of. You see some different skin irritations. Person is always having fever, always getting sick, getting ill. The person, sudden weight loss, a woman that you just see that she's losing weight. She's losing weight. She's not, she just, no matter how much she eats, she's suddenly losing weight. Those are signs that there may be a fistula.
We have, there's this, will I say, an argument or a debate where people were talking about, knowing that obstetric fistula comes with multiple childbearing and all that. So some people are of the opinion that a cesarean section causes this, and some are like, no, it's normal birth that causes this fistula. Now, what does the medical
okay, so from the medical side, what usually causes fistula is a prolonged labor. So prolonged labor, the person may end up doing a cesarean section. But the fact that you've had prolonged labor, what happens in prolonged labor is that the muscles of the uterine wall, the walls of the vagina are being challenged for too long. They are put under a lot of pressure for too long. Normal labor shouldn't go more than 24 hours. That's a more recent teaching. But there are people that don't know that recent teaching and feel that this woman should be strong. 1 day, 2 days, 3 days, 72 hours, 96 hours in labor.
You make mention of leaking of urine and foul odor and feces. Now I want to ask quickly, what happened to be the difference between obstetric fistula and bile, or even the anal fissure, if I may ask?
Okay, obstetric fistula is very obvious. Whatever is leaking through the vagina. Anal fissure has to do with the anus. It's completely different.
But some people, once there's a leaking, they don't even care to check where this leaking is coming up.
The anal fissure is completely different.
Okay.
The way it manifests, the way the picture looks is completely. There are two different openings, and or in one you're having leaking urine, somebody goes to the toilet, after she goes to the toilet, she's still feeling drops on her pants, people are around her, she's always smelling and all that. Or you just suddenly notice that feces is always coming out at the vaginal part instead of the anus. It's completely different. They are two completely different things. And even when they finally go to the hospital and they do the necessary tests, imaging tests, to see, because there are different types of obstetric fistula.
I was about
to see where the hole is, because it can be that the hole is between the vaginal wall and the rectum. The hole can be between the vaginal wall and the bladder. The hole can be between the vaginal wall and the urethra, the vaginal wall and the ureter, depending on where it is. So when you go through those imaging tests, you understand, then you will know, oh, this is actually where it is coming from.
Okay, now you just made mention of the types of this obstetric fistula.
Yes.
Now, okay, can you just, let's say in 60 seconds, or just take us through, so that when someone say, I have this, they will be able to say, this is the type I have.
Well, first and foremost, they may not, as a layman, you may not be able to point out to which type you have.
Oh, okay.
Yes.
So now
it takes a doctor.
Tell us now the way. Tell us now the way.
And the way we usually diagnose that, we see the symptoms.
Okay.
Okay. Of course, if somebody is bringing out feces, obviously you know that there's a rectal, vaginal rectal fistula. Okay. If it is urine, you know it is a vesico-vaginal fistula.
Coming down, the English.
That's why I didn't use those English. So let me
English is
a fistula between the vagina and the bladder.
Oh.
If you see urine. If you see feces, it's a fistula between the vagina and the rectum. Okay? Then, I said it's a fistula between the vagina and the bladder, but it could also be, the person could also be leaking urine, and it can be a fistula between the vagina and the urethra.
Okay,
the urethra is what leads to the bladder, from the kidneys to the bladder. You understand? Also,
anatomy from the
yes.
All right.
Also, you can have between the vagina and the ureter, depending on where the fistula was formed, which comes from the bladder to the urethral opening. So it depends. Right. It depends. But the way you will know this is where it is coming from is when you do imaging.
All right.
Imaging, of course, we won't do X-ray there. We may do they say CT scan, but I'm sure in our environment we'll use cheaper methods.
Oh, CT scan and MRI.
Yeah, they say the book says CT scan and MRI.
Yes.
But I'm very sure we'll look for cheaper methods.
Cheaper methods. Anyway.
Because many of those girls in the north cannot do CT scan and MRI.
Fine. We'll take a short break, and when we return, we'll still be discussing with Dr. Rebecca Mokli, and we'll still be looking at the topic of the day, which is obstetric fistula. And the doctor have helped us talk about the types, symptoms, and we're actually looking at how it can be diagnosed and so many others. But let me tell you something. Send us a question or your contribution or your comment. On YouTube, we have Voice of the People TV, and on other social media platforms, we have VOP TV Live. Just go ahead and drop your comment there, and believe me, we'll read them out during the course of the program. Let's go on a quick break. When we come back, we'll continue. All right, so welcome back. It's your health check on VOP TV, and we're looking at obstetric fistula today with Dr. Rebecca Mokli. Before we observe that break, doctor was trying to tell us why some people will not be able to do the two tests the book said that should be carried out when you notice one or two symptoms in someone's body. We're talking about CT scan and MRI. So now she will tell us what other tests can be done.
Well, the books say CT scan and MRI, and I'll say upfront, I'm not a specialist in that area, but I'm very sure the specialists look for cheaper methods.
Can endoscopy work in this case?
Endoscopy is not for this case.
So endoscopy will not work.
Endoscopy is for the GI.
Down to the stomach.
Down to the stomach, not for that.
Oh, all right. I believe someone must have heard this because we had this conversation,
Yes.
we had this argument. Endoscopy
Endoscopy,
will work, it will not work. But all the same
Endoscopy
now.
is exclusively for the GI.
Oh, all right. Now, the way you made mention or the image you painted about this fistula, it's a bit scary. What can happen if it is not being treated?
There are many things that can happen because that opening is a site for infection. Okay? That opening is a site for infection. So, and you can imagine if urine is leaking and the urethra is connected to the kidney. So if that place gets infected, it goes all the way to the kidneys and you have a kidney infection. And the kidney is very important. Apart from it clearing urine, it also helps to stabilize blood pressure and things. So the person can end up with a kidney disease. They can end up with serious issues of their kidney. Their kidney they can get a pyelonephritis. They can get even more serious kidney issues. But I think the more serious issues with obstetric fistula, apart from the physical complications that can occur, you can have social complications. Many times these people are isolated.
Yeah.
They are thrown out, and they are because they are underskilled and because they are not employed, they can't fend for themselves. So you have somebody that is already very sick, can't eat good food, can't take care of herself. I mean, that's a worse complication of the fistula, aside from the fact that they can end up with serious kidney issues that can even lead to kidney failure. Also, it can lead to a total disruption of their reproductive system. They can end up with infertility because infections can track to different parts of the female reproductive system and lead to infertility. And let's say the lady, comes is able to climb out of it and maybe gets married to a more responsible person, she won't be able to have children, all because of this issue that she had, when she was so much younger or when she was exposed to this sort of thing. And then also there's also the issue with depression, dealing with, because many times, like I said in the past, many times obstetric fistula comes on the back of intrauterine fetal death. That means the baby died in the womb because the labor was for too long. The stress was for too long on the baby. So the woman is dealing with the fact of losing a baby and then these irritations, these smells, this ostracization from the public, from the community, So it is a whole lot.
So how can we prevent this fistula?
I think the very, very first thing is an increase in awareness. Okay? Because I know the government has done a lot to make sure that there's a lot of primary health centers around. You don't need to go to some big hospital to get antenatal care, especially if you are a first-time mother, you are a young mother, you are 16, 17, 18. It's very important to go to the hospital because anything can go wrong.
Anything can go wrong.
No. I'm not saying the older mothers shouldn't go, but the younger women are more susceptible to this because many times their bodies are not fully developed even for what they are about to face, the pregnancy that they are about to go through. So, but many of them don't even know. They don't know they should register for antenatal care. They don't know any of those things. So a lot of awareness has to be created. And I know there's a major issue with culture, religion, and all these things, in trying to even create this awareness amongst them, Okay.
So now, my question will now be, does this obstetric fistula, does it have a cure? And if it does, what is the best treatment for it?
Okay. It does have a cure, but it depends on the size of the obstetric fistula.
Okay.
If it's a very small fistula, you can treat it with antibiotics and a catheter. Of course, you have to educate the patient on how to do it. But if it's a large fistula, the person has to go through surgery.
Surgery.
Yes. And usually what they do is that they take a part of either the person's body or some other...
Grafting.
Yes, they try to do skin grafting to cover the place. But if it's a small one, with proper antibiotics, and we call it a Foley's catheter, and you teach the person how to use it so that they don't reinfect themselves. it can be treated.
So for how long now? What's the span? How long can it take?
It depends.
Okay,
it depends on the size of the fistula.
It depends on the
Yes,
size.
of course, after whatever treatment you choose, they'll be coming for regular checkups.
You made mention of, will I call it now, people who have obstetric fistula being, will I say, stigmatized? Let me put it that way.
Yes.
Now, what's work?
That's very major.
Okay. Now, what do you have to say about the issue of stigmatization in the society? You know, we find out that people who have, some will have HIV/AIDS, the person dies. Not even that the acquired immunodeficiency syndrome kills a person. Some of them die out of the way people treat them and all that. So what do you have to say more about this?
Okay. Like I said before, many times they are treated like that because people around them don't even understand what is going on. Sometimes they feel that they are being punished for something they did. All these are funny local beliefs and things, yes. So a lot of awareness has to happen. A lot of awareness has to happen. And I think it's just a normal human psyche. Someone is smelling funny, everybody avoids them. Even normal, nobody likes body odor. So people have to enlighten them more. And especially when these women taking, they have to enlighten them more. They have to make sure that they don't have to go through that stage of prolonged labor. If they know that their pelvises are too small, they have to stop that. Things like child marriage, I know it's embedded deeply in different parts of our culture, but it has to be discouraged, not because we don't want to keep culture, but because it's detrimental to the major players when it comes to this child.
So you think we should actually imbibe strange punishment? Or are we going to now move on to say we have Nigeria Child's Act saying that if a child...
But we know it doesn't flow in the north.
We're actually going to get
it
there.
It doesn't flow in the north. It's for our book only.
For our book only. Okay, you've heard it all from Dr. Rebecca Mokley, and I believe we've also learned something from what we discussed today, obstetric fistula. And she took her time to explain everything, even the risk factor. If you abandon treating yourself, she talked about you having kidney issues or kidney problems that can also lead to death. Yeah. Yes. And like from what she said, the major cause of this is prolonged labor in women. Child marriage also is part of the things that lead to it. And lack of awareness also can lead to that too. Thank you so much, Dr. Rebecca, for
Thank you very much.
For being part of today's show.
Thank you very much. Thank you.
All right, I told us earlier that Dr. Rebecca is a medical doctor of over 14 years experience, a health and wellness professional for 7 years. And I went for that to explain that she's currently, she writes a weekly online column to over 7,000 lawyers and health professionals give their optimum daily without mortgaging their health for career goals. Currently, she studies, she's studying integrative medicine at Quantum University in Hawaii. And through her work, she's been able to help combine a total of about 200 individuals to manage different health challenges using food. FOOD. You know what they say? Eat healthy, and then you live lengthier. And it's our goal that by 2025, at least 10,000 professionals will be able to give their best in their various fields of endeavor and still maintain optimum health. I'm sure, like I said earlier, you've learned a lot on today's show. Health checks come your way every Tuesday between 2:30 and 3 p.m. on VOP TV. So you can ask a question, even as we're out of the studio, you can ask a question, you can, send us your message, send us your feedback if you have any, drop your comments as regards the discussion of the day, and believe me, we'll reach out to you with a clearer clarification, all right? Don't forget to join us next week for another interesting edition of The Health Check. I am Fina Okechukwu. Have a wonderful day.